Welcome to the Homegrown Heart Podcast, every Friday at 7 a.m. Mountain Standard Time with your host, Dr. Amanda Ryan, DO, MBA, interventional cardiologist, and considered an expert in her field. This week's topic, understanding Medicare plans. Help me welcome our host, Dr. Amanda Ryan.
Good morning. Hi, we're back in action with the Homegrown Heart and your friendly interventional cardiologist, Dr. Amanda Ryan, here in Carlsbad, New Mexico. We've missed you the last few weeks. We went to Becker's ASD conference where we learned a lot about the operational side of ASDs. We represented single specialty ASD. We talked about cardiology. Tami Wacker, who's joining us today, is in our RCM position. Tami, why don't you tell us a little bit about what is the RCM position?
Well, with the revenue cycle manager in different organizations, it's our job to kind of keep all of those moving parts moving and to also realize what their role and how important it is, each person's individual role is, into making sure that the practice from the moment that that patient walks into the building to check in for their appointment, to making sure their insurance is correct, to make sure that they understand their insurance and what they're going to have to pay in this whole process, to making sure it's billed correctly, to making sure that our insurance companies and Medicare, that they're understanding what they owe the practice, and until that claim is billed and closed out from payment, that whole cycle just needs kind of like making sure that all of the wheels are greased and running correctly.
Again, Tami also serves as the director of our foundation, as our executive director of Partners in Heart Health. And so I don't know how we're pulling off both roles. I don't know how any of us are really, our startups have a lot of wheels turning. So we definitely appreciate you in that role also.
I'm going to click on my light as well.
Yeah, I think there we go. So why don't you today, Tami and I, we really wanted to talk about Medicare, the different parts of Medicare, and then our so-called, quote unquote, Medicare Advantage plans or replacement plans, if you will. So Tami, why don't you start a little bit about Part A, Part B? This is open enrollment period here, October to December for patients. Each year, our patients that are 65 and older, as well as some of our disabled patients who are on Medicare, have these choices in their enrollment.
That's correct. So again, like Dr. Ryan stated, every October 15th through December 7th is open enrollment period. Now, the general enrollment period for someone who's turning 65, who's doing that runs January 1st through March 31st. But right now, this open enrollment period is very important because if you've chosen a certain plan in the past and you're not happy with it, you can, during this period, go back and change that up. And that's what's really important. It's important for people to understand what Medicare, what parts there are in it, and sometimes the terminology, really understanding what those terms mean. So you have your Part A Medicare, which is your hospital insurance. So anytime that you go into the hospital and you're checking in, Part A is the only part of Medicare that's going to take care of that. Part B, that's your Medicare coverage, okay? And it's important for people to understand Part A typically doesn't cost anything per month to have, because when you have worked 40 quarters in your life or 10 years, that's your hospital coverage. So every time you got a paycheck, you would see that Medicare insurance being deducted out of there. That's going to pay for your Part A insurance. Now, Part B is for most seniors. It's going to cost about $174.70 a month. That's your medical coverage. That includes long-term care insurance, your doctor's visits. That's Medicare coverage. That's kind of apart from the hospital. Those two things together, Part A and Part B, that covers you at 80% of anything that you get done. That's leaving a massive risk for 20% that that senior, that person is eligible to pay for. And that's why that Medicare makes two options to cover that other 20%. Okay. Now, the first option that we're going to talk about is what everyone hears all over the place. It's called Medicare Advantage plans. And that's where I think the advocates, in both you, Dr. Ryan, and myself, that's where we kind of get cringe a little bit, because I think every day people are are conditioned to hear the term advantage and think, oh, this is to my advantage to take that type of plan. And in reality, a better name for those type of plans is a Medicare replacement plan. And, so replace that word advantage with the word replace.
Yes, Tami, not to cut you off, but what do you think? I mean, I think we share a similar idea here, but what's the reason that makes people concerned about plain Medicare?
Well, I think when they hear that 20%, first of all, they hear 20% and they're like, oh my gosh, I've got to go out here and I've got to get another plan that's going to work to my advantage, that I'm not going to have to pay as much of that 20%. And, they are in their mind thinking, I'm older, I've got this, I've got hip problems, I've got this. So 20%, if I go into the hospital, I'm going to have to pay this huge hospital bill. They hear the term advantage and they're like, I've got to replace that. Okay.
Yeah. I think
and that's,
I agree. I think two things for me, this is a different era as far as society goes too. Traditionally, that 20% was often somebody had retired from a long-term company and had maybe a Blue Cross or a United Healthcare or some kind of, my dad grew up with Caterpillar, just a second. Caterpillar had their own insurance. They were self-insured at a certain point, but it was very common for people to have long-term careers at one place and then have, and then actually that provided their 20% insurance when they did convert to Medicare. And that's been a shift. Most people don't stay at the same company for that long. And number two, even if they do, they're often not provided health insurance. And if they are, even it's not quote unquote free or low cost.
Exactly.
So I think that's a factor. And I think it's how do they cover their medications is another concern.
That is, yes.
I think that our seniors and disabled patients really do struggle with that. Now, again, there's been a very good thing in the last several years that's came around that the max out of pocket is going to be for most drugs with a few caveats, but for 2025 is going to be $2,000 maximum out of pocket in a year, which is still high, but when you think about that, is less than $200 a month.
Exactly. And some of the costs of these medications, I mean, that adds up very quickly for them. And especially, I think if we can, I'll say it now, and I'm going to say it multiple times for the rest of our podcast is, I think we're also dealing with a generation right now that understood what the advantage of having insurance was. You were planning ahead for something. Insurance is for that rainy day that comes and you're like, oh no, what am I going to do? So I think they understand that when you're planning ahead for the year, you're looking at, okay, if I've got $2,000 I'm going to have to spend first. This is a generation that is used to doing that. And so that is a good thing that we're in that mindset for that. I'm not so sure about our generations to come and being secured with that.
And I think the average New Mexican, lives on $1,200 to $1,400 a month of Social Security at 65 plus. So these financial, $167 a month for your Part B, and then your $200 a month for meds and but again, meds there was no cap prior. So capping that that's a whole nother level of discussion. We'll have another podcast for that, but I think that is a great plan. So so go ahead and pick up then again Medicare Advantage or Disadvantage. Sorry.
Well, and I think your points actually go very well with, like, as you look at the different Medicare Advantage plans that are out of there, I mean, they're really trying to sell you on some of those. And some of them are even going to say to our seniors who are living off of that $1,400 a month or $1,700 a month, they're like, hey, you don't even have to pay a premium each month for this Medicare Advantage plan. But the thing that people have to remember with these type of Medicare replacement plans are that you might not have to pay a premium each month, or you might have to pay a very low premium. You are now on the hook for all of the copays. And when you talk about copays, gone are the days of that $20 copay or anything. That's where things are really starting to add up. And it comes up to a lot more than that, maybe $2,000 limit that you would have to pay for a Medicare supplement plan. So doctor visits, hospital stays. Again, the reason why we call these Medicare replacement plans are when you go with a Medicare Advantage plan, you no longer have Medicare. You are buying a policy to take the place of your Medicare Part A, Part B. You are taking that away. So you are replacing Medicare with this Medicare Advantage plan. So that means you're on the hook for all of those copays. You're going to pay at that time. Some of these copays for some of these types of services, they're in the thousands of dollars. So whereas you might have been paying that $174.70 a month for your Medicare Part B that you're only on for 20%, now you've gone way past the 20% of what you would had to pay. And that's where we see this happening during this, when the open enrollment period is done and you've chosen your plan, you have to stick with that plan until that next open enrollment period. So around May and June, when people are really a catastrophe strikes, they're at the doctor's office, then they're at the hospital, and all of these things are really starting to add up. They're like, okay, well, I'd like to switch. I want to go back to my Medicare plan. I want to go back and do that Medicare supplement instead. And you can't. You have to wait. Now, that's why Medicare actually has that second option, which is a Medicare supplement plan. That means it's supplementing everything that you have that can help take care of that 20%. Okay. Some people, we don't have enough time today to go into the, parts D, E, F, G,
Right.
Those type of things. My favorite type is that Medicare supplement plan G. So if you take out a plan G, that premium is going to be the complete opposite of that Advantage or replacement plan. You're going to pay a premium that's anywhere from $120 to $250 a month, okay, depending upon where you live in the United States. And now that you're paying that copay, then you have zero other copays to pay. You're going to pay that $174.70 a month for your Part B, and then you're going to pay the extra $120 to $250. So a month, you're now looking at $350 to $500 a month, but that's it. You can budget. That's what you're paying each month, and everything else is taken care of. And I will say,
I didn't want to cut you off there, but again, I think just that somewhat of signing up for these different plans, especially when you're talking about privatizing, a program, which is really what Medicare Advantage plans do, these replacement plans. I think patients come to the office and they give you their regular Medicare card and this replacement plan, and they fully think they have Medicare
yes,
Plus.
they do.
And it's really, the only thing I can say is that and this is some of our most vulnerable population with our seniors, but we've got to be informed consumers. We just do. Patients have to understand what I think with some of the Advantage plans, it is a little bit of a marketing. It is privatizing a national, a federal program. And part of it I see are things like, oh, they'll pay for dental and they give rides and they do but then like in the rural area we live in, no dentist accepted.
Exactly.
There's no qualified that does the transit, so there's no rides. And you know what I mean? So sometimes it's like, so, it's just kind of one of those. Sometimes if it sounds too good to be true, it might be.
That's exactly right. And exactly. And you really have to do your due diligence as a consumer to search out and see what that difference is. As long as you're going into it knowing that you're replacing your Medicare, not just, adding on to it, that's what makes it so important. I always tell seniors, contact your local senior centers. They're always going to have somebody there that knows the difference of these plans. Again, if you get a call from a Medicare Advantage plan, like your Blue Cross Blue Shield, like your United Healthcare, again, you can always choose. It's your choice to go with that, but do you have all of the information you need? They're going to sell you a product. If you go to someplace like your senior center where they have counselors to do that, go to United Ways. They always have 211 workers that understand the different Medicare plans in your area. Like Dr. Ryan, like you just said, there might be an Advantage plan, but that young person is sitting over in New York. They don't realize that in Carlsbad, New Mexico, they may not have all that transportation that is available there. So go to look up your local area agency on aging. They have the people who are going to say, look, here's all of your options. Here's the advantages. Here's the disadvantages to each one of them. And then that way you can make that informed decision on there. But it's important to remember that when you turn 65, even if it's within, a year's period and it's not in this open enrollment period, you have to sign up for Medicare. Or when you do, and let's say you wait, let's say you put it off for 6 months, or you're like, you know what? I feel wonderful. I don't need Medicare. You know what? You're going to incur a penalty. And that's not what we want you to do, because you're already going to be paying, for your Medicare.
Penalty for not signing up within 90 days of turning 65.
Exactly. So it's important that you do that. Yes. So again, our advice is, know what the difference is between an Advantage plan or replacement, as we like to call it, and a supplement plan. And also remember the fact that you did work those 40 quarters, you worked those 10 years, you paid into Medicare. So utilize what you paid for, because when you now go into go with an Medicare Advantage or replacement plan, you're basically putting all of that to the side that you work so hard for. So keep that under your belt, keep those advantage, and then just go with it someplace else. Look at yourself.
Yes.
And like, what do you have going on in your health field? Yes.
Sorry, we're both so passionate about this. There is a little bit of, I had discussed with you this morning, but one of the patients last week, who's a very informed consumer, told me again, it was her husband's brother, her brother-in-law, who had really told her, look, you guys travel some, you really need to look at your options. You need to go with plain Medicare and a supplement like AARP, Mutual of Omaha, Blue Cross, something in that field. And I asked her, she said, yes, between the two of us, her and her husband, they pay about $700 to $800 a month. And now again, if I'm living on $1,200 to $1,400, yes, I'm like, that's a little bit. Now, fortunately, they have a little more income than that between the two of them, but still, even if you've got two incomes and you're looking at $2,800, $700 to $800 of it going for your health insurance, that is a decent chunk. At the same time, she said out of pocket, she has been all over the country. Her and her husband have had many, many tests, procedures, hospitalizations, you name it. She has never came out of her pocket for an extra dollar. Every single has been approved. It's been, I think that's something people don't always understand either when choosing insurance, that then your insurance has a right to say yes or no to your physician that you can get procedures done. Now, Medicare follows strict guidelines. And there are some procedures that they require authorization for too, but it isn't near on the level
Yeah,
that some of these other plans actually require. I mean, insurance is big business, and we just need to remember that. That's not,
exactly.
I mean, they're paying our salary so that we can help take care of patients. So I'm not here to bash the insurance industry, but just to make sure that we're realistic and that our patients are informed. I think that's my biggest thing. I think, as you stated, we think something cheaper, maybe this is $300 a month between two people, 150 each. Like, oh my gosh, this is so cheap, cheaper than just plain Medicare, even just the Part B. Plus, I got to pay a supplement, this kind of thing. And I think people don't understand how fast some of those co-pays. What if a service is denied? All of a sudden, they're choosing all doctors. There's even some large health plans, if you've been following, that are not taking some of the Medicare Advantage plans now.
Absolutely.
That could literally limit your hospitalization choices. And in our rural area, that's devastating. And even if you're in an urban area, you're going to have to go across town to the hospital that will accept your
Exactly.
plan. I mean, all these things are just, it's important and important considerations.
Well, and another thing to remember with your Medicare Advantage or replacement plans, when they give you a quote on this is what your premium is going to be, that is what your premium is going to be. With the supplement plans, they remember that's a government basically run supplement plan offering. So they will also look at your income. And so whereas me and my friend Joan over here, if I earn less than her on a monthly basis, my premium may be lower than hers. It is based on your income. So that's a good thing to remember too. Again, the figures that we're throwing out, that's why for a supplement plan, it can be anywhere from $120 to $250 a month. But the reason why there's so much of a difference in those two amounts is it is dependent upon your income. So if you're living on a very low fixed Social Security income, looking at that supplement and what they can do for you, it really makes a big difference. Whereas your Advantage plans, no, they're not going to adjust that based on your income. So again, if I can give any advice is know yourself, know where you're at in your health journey. Look at the year ahead. Are you having a little bit more aches and pains? The patient you were just talking about, it sounds like that they realize that they do have a lot that is going on, and they're going to be visiting, an interventional cardiologist. They know of what's going on. You've got to take all that into consideration, because although you're just, if you're looking at an Advantage plan that you're like, oh, but I don't have any monthly premiums that I have to pay. But again, if you're going to have all of those co-pays that is going to be adding up each month because of what you're encountering with your health, then it's really not saving you money at all. So know yourself, know your budget, but also know your body.
Agreed. Thank you, Tami. I think it's been great discussion. I think, we're passionate about our patients, about all of, our advanced ASC, our Advanced Heart and Vascular Center of New Mexico, AHV&M, and Partners in Heart Health. As part of that, as a physician, as a leader, Tami, as a leader within our organizations, we are here for you to provide you as fair and unbiased information as we can. We do not have all the answers, but we certainly have what I would consider educated, informed opinions. And I just encourage everybody to, to get the same as far as making those decisions about not just Medicare and Medicare Advantage, but any plan that sometimes patients don't understand they've chosen a high deductible plan, or their insurer has, and it's a $10,000 deductible before it pays absolutely anything. And then they're having procedures done, and, something may cost at one facility $2,000, at another facility $500. If you're paying that out of your pocket, you need to be an informed shopper. And I would say, even if it's your insurance paying it, we all need to be part of the solution to our current healthcare crisis. There is a lot of waste in our healthcare system. There is a lot of money that's going towards things that are not really benefiting the system, the patients, the providers in the way that they should, in my opinion. And so I think all of us, we've got to be informed consumers.
And by all means, if anyone watching the podcast, whether it's for themselves or whether it's for a friend or family member, if you have any questions, we're not going to be able to give you the advice of, hey, you need to do this, but certainly give us a call at 575-302-1666. We can get you to that right person that can sit down with you and help give you the education and information that you need. You can email us at partnersinhearthealth@gmail.com. Again, we're wanting to make sure that you have all the information you need to make the informed decisions that you need to this year. Okay?
Great. Well, podcast listeners, it was great to be back, and we'll see you next week too. Hopefully you've learned a lot, and we'll continue to build upon this in future episodes.
All right. Thanks, Dr. Ryan.